Hello everyone, I'm Dr. Luca Pasquini and I'm currently working at Memorial Sloan Kettering Cancer Center in New York City. I've always been fascinated by neuroscience. This is the reason why I studied medicine in the first place, and this is also the reason why I obtained a PhD in neuroscience and I decided to become an expert in brain imaging. My main area of interest is neuroplasticity, meaning the ability of the brain to reorganize its functions in response to the growth of a tumor, for example, or a stroke, or any type of focal lesion that is creating some sort of clinical deficit. So basically it's a way of the brain to compensate for these deficits and to try to maintain its function. It's a defense mechanism. So what happens when we have a focal lesion such as a tumor growing in a cortical area which supports language function? What happens is that the function is lost. There is a so-called speech deficit. And this is what we really want to address with our research, finding ways to decrease, minimize, and even overcome in the first place the development of this type of deficits. So what we have been studying in our research is the mechanisms that underlie the reorganization of language in brain tumors. These include the tumor size, the location, but also the genetics and patient variables, like, for example, patient age or sex, all very important for this phenomenon. And even more, we have been studying, we have been imaging the neuroplasticity through a very exceptional technique, which is a functional MRI, so that we were able to image the development of plasticity over time in longitudinal studies. And this is really important for the patient, but also for the surgeon. And the reason is because the loss of functions, especially the speech, is really affecting the quality of life of these cancer patients. Imagine if a person with a brain tumor loses the capability of communicating with the family, with the surrounding people. This is really something that can tremendously affect their quality of life. So this is very important, but also for the surgeon who is supposed to resect the tumor, to take the tumor out from the brain. It's really important to know and to understand where the language function is located next to the tumor. And if the language function moved over due to neuroplasticity, it's really important to be aware of this, because this is going to affect the amount of tumor that the surgeon can resect, and ultimately the outcome for the patient. The beauty of functional MRI is that it allows us to study, to see the brain functioning in real time while the patient is performing a task, such as language, for example. What we do basically is to image the changes in blood supply to the brain. So in this moment, for example, I'm speaking, so the language areas in my brain are active and they are working to support my speech. And for this reason, they need more blood supply, more nutrients to support their function. And we are able to see these changes in blood supply, specifically of oxyhemoglobin, through functional neuroimaging. So this is what we do, and the exceptionality of this technique is the fact that it's non-invasive and can really depict the active areas related to a specific function in real time. I think this type of research is really looking to the future. I imagine a future of our practice as neuroradiologists when we can really identify neuroplasticity and we can even enhance it. For example, before a surgery for a brain tumor, we could be able to enhance the plasticity so that the function, for example, language function, can move away from the tumor, and then the surgeon can resect more safely the lesion without any deficit after surgery. I think this is really the field of the future research. The RSNA Fellow Grant really helped me to lay the foundation of this research that I want to keep pursuing with my career by applying to additional funding and then building this research line for the future. I'm really thankful for the opportunities that the RSNA Foundation offers every year to young researchers such as me. I think this is a great start for academic career, and I really hope that the foundation will keep offering these opportunities for the future. Thank you.